Hi there, Simon from Creative State Counselling and Psychotherapy. So say you come along for depression. The first thing that we're likely to do is to agree with you that it absolutely sucks. And we know that you're not making it up. But as we get into kind of how you've been feeling in the last few weeks, what we might start working on is being able to tell the difference. When is the depression talking and when is it kind of reality? Because the depressed brain has a lot of trouble telling the difference between those two things. And when people can learn the skill of monitoring their thoughts and feelings and knowing when it's the depression driving the bus, they tend to recover a lot faster. And one of the ways that we do that is through cognitive behavioral therapy. And the second thing that we might do, we understand that depression just keeps you so locked in and so stuck and you feel like you can't do anything. We might investigate what it is that you can do. For example, if you're feeling like absolute shit and you can't even have a shower, maybe we can work on doing simple things like washing your face. Or if your room's an absolute mess and it looks like it's been ransacked by the CIA, is it too much to clean your entire room? It probably is. But we can clean our desk. And if we can't clean our desk, we can clean a portion of our desk. Because the depressed brain is going to keep you from doing a lot of stuff. So what is it that you can do? And we're going to work on that and build up from there. And the third thing that we might do is to encourage you just to check in with your doctor, your family practitioner or your GP, to see if medication is going to be necessary. Because untreated and unchecked, depression can be quite serious. And there's a bit of a debate at the moment, or there has been for some time, about medication. Does it work? Does it not work? Is it really serotonin in the brain that it's targeting? Is it a placebo effect? The fact is, a lot of people get a lot of benefit out of medication, and for them it's an absolute game changer. Some people struggle, or other people struggle with finding the right medication. It kind of works for some of the time and then it stops working. And for other people, the side effects are just too much to bear. They're too intrusive in their life and they tend to give up the medication. But we would always encourage a person to check in with their doctor and do a bit of a cost-benefit analysis. What's the cost of not being on medication compared to the benefit of being on medication? And the last thing that we might tell you is this is tricky. It takes some time to work our way out of depression, but with support from your family, your loved ones, your doctor, and a counsellor and psychotherapist that you can trust, often the results are excellent. So in the meantime, take care and be good to yourself.